My pregnancy started off simple and easy. Then one day, like a snap of a finger, everything changed and my baby's life was in danger and had to be born very early to save their life. In this video, I'm going to finally share my whole crazy and unique pregnancy and birth story from beginning to end. So grab your favorite drink and come join me. Hi there. If we haven't met, my name is Iman, and on this channel I teach moms and their families all about their high-risk pregnancy and the NICU to decrease fear and increase confidence. So I found out I was pregnant on October 15, 2017. This was my first pregnancy and my first baby. From the beginning, I wanted the gender to be a surprise. I did not want to find out what the gender was. Overall, my early stages of pregnancy, I had no symptoms. I had slight nausea here and there with the smell of zucchini. I know, that's weird. But otherwise, I had no other pregnancy symptoms. So I had my first ultrasound, which was a dating ultrasound, around November. And this ultrasound is the ultrasound that they look at the heartbeat and they give you an approximate date of when your due date would be. So on my ultrasound, the heartbeat was strong, baby looked good, baby was measuring appropriately, and they gave me a due date of June 10, 2018, which I can't believe I still remember that date because that is not my son's birthday anymore. So usually after the first ultrasound, the next ultrasound would be around the 18 to 20 weeks, which is the full anatomy scan ultrasound. But something big happened to me before that ultrasound. At 11 weeks, I was feeling good, going to my job at the NICU, everything was going well. So it was my day off and it was the evening. I clearly remember that it was evening time. I sat down, drinking a warm drink and watching TV. And then I coughed. And then once I coughed, I felt wetness. Just all wetness. I ran to the bathroom and I was bleeding. It actually soaked through my dress as well. I was terrified, and at that point I knew that I might be miscarrying. I had no cramps, no abdominal pain. So my husband and I went straight to the ER to get assessed. I got an ultrasound done at the ER and the baby looked good, everything looked good. But they noticed that I had something called subchorionic hematoma. So subchorionic hematoma is a collection of blood under where the placenta would eventually be created and the uterine wall. I made a whole video on what subchorionic hematoma actually is. So if you're interested in learning about this type of bleeding, make sure you check out the video that I've done. I'll link it up somewhere here or check down in the description box. This type of bleeding actually happens more often than you think. But I never heard about it, ever. I don't know anybody that's gone through it, and I've never heard about it as a nurse as well. Comment down below if you've ever heard of a subchorionic hematoma or subchorionic hemorrhage. I'm wondering because it is actually a common first trimester bleeding, but most people have never heard of it. So comment down below. So with this type of hematoma, either you bleed it all out or your body absorbs it to heal. What happened to me is that I bled. I bled for a good month and a half. At first, the bleeding was more mild and then it decreased to more spotting. But I talk about all that in my subchorionic hematoma video, so check that out. At 15 weeks, I had a repeat ultrasound just to assess that hematoma, and it was getting smaller. And I was still bleeding at this point. At 17 weeks is when my bleeding finally stopped. So that means I was bleeding for a good month and a half. So I got to my 22-week ultrasound, which is the ultrasound that they look at the baby's anatomy, physiology, every organ. This is a very detailed anatomy exam of the baby. And at this ultrasound, they noticed that my subchorionic hematoma has fully healed. Thank God. And also my baby was growing well, doing well, moving, everything looked good and normal. So that was a good ultrasound. And also remember, this is the ultrasound between 18 to 22 weeks where they can see the gender. So the technician asked me if I wanted to know the gender, and remember, I did not want to know. I wanted to be a surprise. But remember, I had so many ultrasounds before this ultrasound, and every ultrasound, I would just see the baby moving and wiggling, and it made me really want to know even more. I keep seeing the baby in the many ultrasounds that I've had. Hope that makes sense. But anyway, so I ended up caving in and just wanted to know what the gender was. And it was a boy. And I was actually shocked because I was so confident my firstborn would be a girl. I had a boy and I was going to be a boy mom. So usually after this ultrasound, between 18 to 22 weeks, if everything looks good and there's no worry, then most women do not have another ultrasound until they're in the middle of their 3rd trimester. But for me, at the end of this ultrasound, the doctor came in and said everything looked good, but she just noticed that he was measuring smaller than a regular 22-weeker. She just wanted to do a repeat ultrasound just to double check his growth at 28 weeks. So I had my next ultrasound booked for 28 weeks. And I was not worried at all. I felt good. I understood her recommendation, the doctor's recommendation. So I was not worried at all. So I went back to my life, working, living my life. So the day before my 28-week ultrasound, I remember that day very clearly because I was working a night shift. It was a Tuesday and I went in for a night shift. So I worked from 7 p.m. to 7 a.m. and I was taking care of a really small baby. I had a good shift. And then after that shift, the Wednesday morning, I had my ultrasound at 8:30 in the morning. And at this point, I was 29 weeks. And remember, I was feeling good. Everything looked good. I had no bleeding, no cramping, no other complication that I saw. Baby was moving well. So I felt good going into this ultrasound. So my husband was there and the technician was doing the ultrasound. She was a bit quiet, but she was still talking. So I didn't really notice that something was wrong. And then she told me that she would get the doctor, which is a normal protocol. Usually doctors come after the ultrasound to come talk to you. And then she came back to take us to a small room. And that's when I knew that they saw something wrong. They saw a complication. Oh, I can't believe it. It brings back so many memories, but that's when I knew. So we went into this small room and the doctor came in, sat down and talked to us. He told us that the placenta was not providing enough blood and nutrition to my baby and my baby was not growing properly and that I would definitely have a premature baby. And that is when I bawled. I cried and cried and cried in that room because I knew what a premature baby was and the challenges that they might face because this was my job. And I never in a million years thought that I would have a premature baby. Like, you never do. He also told us that because he wasn't growing, he was considered IUGR, intrauterine growth restricted. That means he was not growing inside of me, and that I would be hospitalized that day to be monitored. So that day I went home, packed up a quick bag. I didn't even have a hospital bag ready because I didn't realize I would be hospitalized. So I had nothing prepared. I took a bag, I just packed it up, and I went to the hospital because I was considered high risk and I was being hospitalized. That was March 28, 2018, and I was 29 weeks. So I went to the hospital and I was hospitalized in the Antepartum unit. So I was in the Antepartum unit as a patient being monitored with my pregnancy. So I would be in this Antepartum unit for 2 weeks before I gave birth. I was so emotional at this point in my life because literally I walked past my unit, the NICU, never thinking that I would ever have my baby going there. And now I'm definitely gonna have a baby in the NICU. So I was very emotional and I kept telling my healthcare team that this baby is not being born earlier than 32 weeks because I knew the complication that can happen. The baby was born earlier than 32 weeks. I also told my team, and I also knew this, that if any further complications happened that put my life at risk or my baby's life at risk, I was completely okay for my baby to be born at that moment. Because at the end of the day, I want to be alive and I want my baby to be alive. And the labor and delivery team and the NICU team, they try to keep the baby in for as long as possible, as long as the mom is safe and the baby is safe. And sometimes moms and dads, it's safer for our babies to be outside than inside. And this was the case for my baby boy. We had ultrasounds every day in the hospital. We had blood tests weekly. We had the non-stress tests 2 times a day to monitor heartbeat and movement. And that is the band that they put around your belly. And they noticed at every ultrasound, at every non-stress test, that he was getting stressed and worse. My healthcare team would tell me every day to prepare to give birth that day. That's how fast my pregnancy was declining. Then thank God, one day he started to settle down and get a bit better. The ultrasounds were starting to look a bit better. Like I said, I was in the hospital for 2 weeks. And being hospitalized with pregnancy is a whole different challenge. And this is because you feel like you are the only one. You're isolated in there, you feel alone, no one understands what you're going through. You are in constant fear for yourself and for your baby. You're also bored out of your mind. You don't know what the future holds for your baby. It's just so much emotional turmoil that goes on in your head when you are hospitalized with pregnancy. It is not easy. And this was before the actual NICU experience. So shameless plug, I actually wrote a whole ebook to help moms that are going through this experience of being hospitalized with high-risk pregnancy. In this ebook, I included actionable tips that really helped me get through this part of my pregnancy from the perspective of a nurse and a mom. So if you are going through the hospitalization of your high-risk pregnancy and you are terrified and you need some advice, go check out my must-have guide for high-risk pregnancy hospitalization. So in that 2 weeks I was hospitalized, I was able to go home for a couple of days and then I had to return. Also, in this period that I was hospitalized, I got my 2 steroid shots. So these shots are for moms who might deliver before 34 weeks. And receiving these 2 steroid shots can improve your baby's chance of doing well in the NICU because these steroid shots causes the lungs to grow in a much faster rate. So getting this steroid shot is really important when you're about to have a premature baby. And then at 31 and 2, I got a rash. So this rash started on my stomach and it just spread all over. My arms, my chest, my legs, up to my neck. So it literally was neck down in a couple of days. It spread so fast. It was red, it was itchy, it was raised. I'll actually insert a photo of how it looked like. So at first, my OB thought it was a regular pregnancy rash, but because of how fast it grew, she was worried. My OB then thought it could be something else. So they consulted dermatology, and the dermatologist actually came to me to do a skin biopsy to figure out what this rash could be. And then after like 24 hours later, I was told that it was something called pemphigoid gestationis. I can never catch a break. Alhamdulillah, thank God. So this rash, pemphigoid gestationis, was a rare autoimmune skin rash that happens in the 2nd or 3rd trimester of pregnancy. It only happens in pregnancy and it's actually very rare. What pemphigoid gestationis did is that it caused my own immune system to produce autoantibodies to attack my own skin. The complication of this rash is having a small baby or having a premature baby. So my OB was really nervous about this rash. She's heard of it, she's learned about it, but it was rare. And so my OB and I talked and she told me that she was worried about the safety of my baby and that she feels comfortable to deliver my baby as soon as possible. So I was booked for a C-section the next day. And at this point, I was 31 and 4. So for me, I had to have a C-section because a vaginal delivery was not an option for me due to the stress my baby was under because of the placenta. Comment below if you've ever had a premature baby. How did you deliver your baby? Was it C-section or a vaginal delivery? Because most people think premature babies are only delivered through C-section. They are not. There are many premature babies that are delivered vaginally as well. So just comment below, what kind of delivery have you had? So the next day, April 13, I went in for my scheduled C-section. So I went in, I got my IV, I signed all my consent forms, took me into the OR, they started the anesthesia, I got a spinal for my C-section, and then I would say in 15 minutes, my son was born. It was so fast. My son was born on Friday, April 13, 2018. He came out crying and screaming and moving around, so which is always a good sign. He was 2 pounds and 14 ounces. The NICU team was there right away to take my baby and stabilize him, and they took him to the NICU for further assessment, and my husband went with them. Once I was stable in the labor and delivery room, my nurse took me over to the NICU to see my baby for the first time, and I couldn't believe it. I literally walked into my unit, just going through that hallway, going through those doors that I go into every day to go to work, and I am going in there as a patient. I was wheeled into the NICU on a stretcher, and then I finally saw my son in an isolette with wires, an IV, a breathing machine called the CPAP, and I couldn't imagine that was my own baby. He was beautiful. Based on what I could see, he was doing well. He had a breathing machine called CPAP to help with his breathing. He had an IV for fluids and nutrition. He had a feeding tube in his mouth, and he was in an isolette. But otherwise, he seemed like he had the most common wires and tubes that we normally give for babies his age. So I was there visiting my baby, and I had my coworkers just surrounding my stretcher, and everybody was shocked. All my coworkers were shocked that I was there because I literally worked 2 weeks before, and nobody knew I was coming except the charge nurses, but everybody was surprised that my baby was here. So we decided to name him Bilal. He was really small for his age. He was 2 pounds 14 ounces, so that's the same size of maybe a 29-weeker. After I visited my baby, took photos of my baby, I went over to the postpartum unit. And then as soon as I got over there, I asked for the pumping equipment and I started to pump. Pumping right away is really important and key when your baby is in the NICU, just to start establishing your milk supply. So being in postpartum sucked. It was not fun being on a unit, constantly hearing crying babies, and your baby is not with you. The good thing is, at the hospital that I was at, they usually try to keep NICU moms together as roommates. So the lady that was right beside me also was a NICU mom and had her baby in the NICU. So in our room, we had no babies, but we can hear the other babies in the other room, and it's hard. It really is. At the same time, you're visiting your baby every day. So you get up and you have to walk across the hall to visit your baby. So having your baby in the NICU is one of the hardest things a mom would ever experience. And then after 2 days, I was discharged and I had to go home without my baby. And I bawled my eyes out. I was so, not only are you like emotional just because you just gave birth, but you are separated from your baby, and it's really, really hard. It's like you're leaving a part of yourself at the hospital, and it's unnatural actually. But my baby was born premature, and he needed this equipment, and he needed the actual NICU to stay alive. So in the NICU, my son has a couple of problems. First was breathing. Because he was born really premature, he couldn't breathe on his own. So he had a machine called CPAP. Number 2, he had feeding problems. He would constantly have regurges and throw ups. He just wasn't tolerating my breast milk for a good 2 weeks. And that is because he was IUGR, intrauterine growth restricted, meaning when he was inside of me, very stressed, all the blood supply went to his brain and his heart to keep him alive. And he had less blood going to his tummy. So these babies tend to have a lot of feeding problems when they are born, which happened to my son. And number 3, because he was born really small for his age, he had growth problems. And this is the problem we had after he got home as well. And it took him a while to catch up with his growth. And then after a couple weeks, he got off CPAP, he was feeding well, he was starting to learn how to nurse and bottle feed, and then they eventually took out his feeding tube. And then finally, after 28 days, Bilal came home. And now, 3 years later, he's had some challenges, but overall, he's healthy, happy boy. Thank God. So, if you've been here for this long, thank you. I really, really appreciate you staying and listening to my crazy story. But going through a high-risk pregnancy in the NICU is very, very difficult. No one understands it unless they went through it themselves. But I just want to say to the moms and dads that are going through it that it will end eventually, because everything comes to an end and eventually your baby can come home. So don't give up hope. There are many families who've gone through what you are going through and are on the other side now. So just hold on, keep pushing, and it will end. There are many reasons why a pregnancy might turn high risk and cause that baby to be born early. In the last 8 years of working in the NICU, I noticed that there are the same common conditions that can cause a preterm delivery. Check out this video to learn the 6 most common causes that causes a mom to deliver her baby early.